Dr. Sajid here again. I'm going to be talking about the current pandemic that I'm sure you're all aware of, and this is about the COVID-19. This is a virus. A virus is a germ, basically smaller than the other germ, which is bacteria, and children will suffer both from bacterial and from viral diseases, but this one is a virus. Interestingly, it's not a virus that is living in itself, but once it enters the body of children or of adults, it starts growing in cells and it becomes invigorated. Now, it takes about anywhere from 3-4 days to about 14 or 15 days for this condition to become evident, for the child to have symptoms. So if one gets the virus, then that is the time that it takes for this virus to incubate in the body, and therefore it's called the incubation period. Now, how do you recognize it? Most children will get fever, and the fever is generally high and the child becomes quite uncomfortable, and it's constant. It's not like a little bit of fever, it is generally high fever. And if the child will complain of headaches or body aches. Along with it, there may be cough, which is rather dry, and maybe some sore throat, and they will often complain of losing their sense of smell or their sense of taste. Now, generally, our experience is that this is commonest between the ages of 7 to 10, but it can also occur in younger children, and in the younger children, you can have what we call gastrointestinal symptoms. So vomiting, diarrhea and abdominal pain can be seen. Of course, you have to understand that if you have suspicion, you should check with your doctor. You have to have had a history of contact, which means somebody else has to have given it to the child, and it invariably is either somebody at home, another adult, or a child. And that would have happened, like I said, maybe within the last 2 weeks. So when you talk to your doctor, he may order some blood tests, but most important, of course, is a test taken from the nose and the throat. It is like a nasal swab, and that will confirm whether your child has it or not. Most of these children can be managed at home, and it's not generally, like I said, not very serious. So what do? You keep the child comfortable, you give some medicine for fever, perhaps paracetamol is best, and make sure that the child is eating normally and a normal diet that he or she is used to. And only if the child seems to get sicker, becoming lethargic, or the cough is getting worse, or the fever is getting higher, or the child is getting shorter breath, or his breathing is labored or rapid, then you have to check with the doctor. Now, this epidemic or this pandemic has caused a lot of anxiety. Children have to stay home, parents have to stay home, and there are a few tips for increasing or getting your child's immunity at a higher level, which will help prevent. One is, of course, to prevent contact with other people, so avoid crowded places, places where other people may not be taking precautions and your child may get the infection. Second is, the child should eat normally. Good nutrition gives you good immunity, and the child should continue to do a little bit of exercise, play. So don't sort of restrict him at home, and don't let him just sit in front of the TV and not play outside. He should, of course, be given the routine immunizations against some very common and deadly diseases, and this is very important, especially for the younger ones. Don't forget that there are a number of very dangerous infectious diseases, and your baby or your child must be immunized against them. What is the prevention? It is the same: washing hands after you go to the toilet, before you eat, and otherwise if you've touched anything that is not clean. Children will rarely need to wear a mask, but the grown-ups should, in the presence of children, and they should maintain a distance from those who are either coughing or sneezing. So if you take these precautions, the disease is fairly manageable and is not very serious in most children, and if you can prevent it, that is the best thing to do.